A well woman exam typically entails kind of a head to toe physical. We feel for thyroid because thyroid issues are actually really common in women. We do breast exams, checking for any lumps or bumps that women may feel. We will often also feel the abdomen, listen for bowels, anything like that. And then the obvious pelvic exam. In a well woman exam, we can do what I call the well woman labs. It checks the actual blood levels of a thyroid. And then it also I check for a CBC and CMP, which checks for any anemia, because when you're menstruating, often people are anemic. And I also check for the hemoglobin A1C, checks the blood sugar. It's an average, it's a percentage over the last 3 months. It just checks for any pre-diabetes or existing diabetes, and the lipids, cholesterol, making sure that those are all within normal ranges. And then we can also do STI testing. The biggest things that I want women to know when they come in is the self-breast awareness piece. And then to also know what their PAP is, or when they had one, and to know when they need to come back to be tested. Because the recommendation changes depending on your age and what kind of testing was done, from either 3 years or to 5 years. But the annual exam is more than that. I mean, we cover menopause, we cover birth control, we cover preconception counseling. Annual exams are that time also where we can help you set goals. Or if you have a goal, if you're like, I want to be healthy, well, part of that is checking your blood levels of your triglycerides and your cholesterol and knowing where those numbers sit, because that's a piece of your health. Well, as a midwife, I always like to tell people that while yes, part of my job is taking care of babies, my job is really women's health as a whole, which covers everything from birth control to annual exams, to even just general check-ins or STI testing, health labs, throughout the spectrum, from all of womanhood.